name is Cassie. I'm going to be your student nurse today, performing hand hygiene right now. Would you please identify yourself? Great. So today I will be performing I will be changing your dirty dressing, irrigating your wound, taking a culture on your wound, and putting a clean dressing on your wound. So to get started, I'm going to get clean gloves. Put on clean gloves. I will be removing your dressing, making sure that you are still covered. I'll pinch it right here and carefully remove the tape. If the tape is sticking, I can use a tape remover. I will be assessing the pad to see if there's any secretions or anything that I need to document on it. There is not, so I will dispose of my dressing and my gloves. And now I will put on new clean gloves to measure the wound. And to pour my solution. I'll lip it off, and then I will come and I will pour the solution in here. Now that that is ready, I will go and measure my patient's wound. And then after that, throw that away. I will get out a clean Q-tip. Now I'll measure the depth of the wound. After I do that, I take it back to my tape measure and I measure the depth, and then I can document all of that. Then I take off these gloves to set up my sterile field. So now I'll be setting up my sterile field. Away from me. And my sterile field. Put that on my sterile field. Now I'll get all the proper equipment for this procedure, making sure that I keep any contaminants away from my sterile field. I'll also be performing a culture of the wound, so I'll be putting my culture, my clean culture on there. My new abdominal pad, which is right here, and some cotton tip applicators to put any antiseptic or antibiotics on the wound. And here's my basin. So now I will put on sterile gloves to continue my procedure. Taking my dominant hand, I'm going to put my non-dominant in first. Going under. Grab my dominant. Get it to the sterile glove. I am now ready to irrigate my patient's wound. Taking the syringe in my non-dominant, I will be sucking up all of my solution, and in my dominant I will be taking the basin. As I do this, So I will put the basin up close to my patient's skin and irrigate the wound until it runs clear. Now that it's ran clear, I'll set this to the side. And I will dry my patient's wound with these gauze. I'll do it in 2 steps. Dry that, throw it away, take more gauze, dry that, throw it away. I will now be getting the culture, so I'm gonna put on new sterile gloves. These are my new sterile gloves. Now I will be getting my culture, taking it carefully out of the package, pressing and rolling to get fluid out of the wound. Now as I go back in, I have to be careful to not touch any of the edges of the container. Now I will have to document, or I will have to label this when I'm all done. So I'm just gonna set that to the side for now. And now I will put any antibiotics that I need to on the wound. So for this purpose, we're gonna act like I have some right here. I will be putting it on the wound. And if I need to, I can throw this away and take another and put this on the wound as well. And now I will be replacing my patient's clean dressing. I will take the new dressing at this time I should apply some skin protectant around the area so that fluids do not irritate the skin. I'll take my new pad, put it over the wound, take my tape, and make sure that I have a tight bond with the skin. And then I should do that all the way around. And then I also would like to put the date and time. So I would put the date, time, initials on here and put it on their dressing. And then I will clean up my whole space, throw away everything, and perform hand hygiene again. And then I will be done with this procedure. I will also document everything that I have just done here, and I will make sure to label my culture tube.